Today, we're going to dive into a really fascinating and, well, precise form of cancer treatment. It's called brachytherapy. And the whole idea is to take the fight directly to the tumor, attacking it from the inside out. So, let's get into how it all works. First, we're going to get our heads around the core idea of this internal radiation. Then we'll look at a big variable, the speed of the treatment. After that, we'll explore whether the radiation source is permanent or just temporary, and see how doctors choose the perfect tool for the job. And we'll wrap it all up with the key takeaway here, which is all about a personalized attack on cancer. All right, let's jump right in. Section 1, Fighting Cancer from Within. We're going to look at the fundamental concept behind internal radiation. So, let's start with the biggest challenge in almost any kind of radiation therapy, right? How in the world do you deliver a dose that's strong enough to obliterate cancer cells, but at the same time you have to minimize the damage to all the healthy organs and tissues that are sitting right next to it? It's a super delicate balancing act, and it's exactly the problem that brachytherapy was designed to solve. And the solution is actually pretty brilliant. The name itself, brachytherapy, gives us a huge clue. Brachy is Greek for short distance. So instead of beaming radiation from way outside the body, a tiny sealed source of radiation is placed directly inside or right next to the tumor. This means you get a maximum powerful dose exactly where it needs to be, and the radiation drops off really fast, which protects all that surrounding healthy tissue. That precision, that's the whole ballgame. Okay, so now that we know what it is, let's talk about how it's delivered. Section 2 is all about a question of speed, and you can think of this as the difference between a slow burn and a bright flash. You can kind of think of it in two main flavors. First, you've got low dose rate, or LDR. This is like a slow burning candle, delivering a really steady, continuous dose of radiation over a few days. Then you've got the other approach, high dose rate, or HDR. And this is like a quick, bright camera flash, a super powerful, super targeted dose delivered in just a few minutes, but it's usually repeated over several sessions. And, these different speeds have a huge impact on what the experience is actually like for a patient. Because LDR is continuous, it often means a short stay in the hospital. But with HDR, with those quick bursts of radiation, it's usually an outpatient procedure. You can go home pretty much the same day. And as you can see, they use different radioactive sources, and HDR has another big benefit. It drastically reduces any radiation exposure for the medical team. All right, so we've covered the speed of the treatment. Now let's ask a different question. How long does the radiation source actually stick around? This brings us to permanent versus temporary implants. First up, we've got what's called permanent brachytherapy, and it's pretty much what it sounds like. In this approach, these tiny little radioactive seeds, and we're talking about the size of a grain of rice, are put right into the tumor, and they're just left there. They do their job over weeks or months, and their radioactivity slowly and safely fizzles out until there's nothing left. Now, because these seeds are left in to work over time, it is, by its very nature, a low-dose rate, or LDR treatment. It's that slow and steady approach we talked about. And this makes it a really effective choice for treating prostate cancer, where these seeds can be placed with incredible precision to work against the tumor for a long time. Now, on the flip side, as you probably guessed, is temporary brachytherapy. With this method, nothing is left behind in the body. A delivery device, maybe a thin tube or a catheter, is placed in the treatment area. Then the radioactive source is sent through that device to do its job, and once the treatment is over, the source is completely taken out. The big advantage here? It's all about versatility. Because the source is removed, doctors can use either the slow and steady LDR approach or the fast and powerful HDR approach. This flexibility makes temporary brachytherapy a fantastic tool for a wider range of cancers, like those of the cervix, breast, and even skin. Okay, this is where it all starts to come together. Section 4, the right tool for a job, because it's all about matching the specific treatment to the specific cancer. I love this analogy because it really just nails the whole philosophy here. There's no single best type of brachytherapy. It really is like a surgeon reaching for exactly the right instrument. The decision is all about picking the perfect tool for the specific job that needs to get done. And this chart really lays it all out, showing how everything we've talked about, LDR, HDR, permanent, temporary, gets matched to a specific cancer. So for a slow-growing, contained tumor like in the prostate, permanent LDR seeds are just ideal. For cervical cancer, where you need a high dose in a very specific cavity, temporary HDR is a perfect fit. And for some breast or skin cancers, temporary HDR lets doctors precisely treat the affected area with maximum control. Okay, so we know the what and the why, but there's one last little piece to the puzzle. How do doctors physically get the source into place? Well, there are two main methods. Interstitial, that just means the sources are placed directly into the tumor tissue itself. Think of those seeds for prostate cancer we talked about. Intracavitary, on the other hand, means an applicator is placed inside a natural body cavity, like for treating cervical cancer. The method is really just chosen based on where the tumor is and how easy it is to get to. All right, let's bring it all home. Section 5 is our big takeaway. This is a truly personalized attack. When you boil it all down, the real magic of brachytherapy isn't just about being powerful. It's about being incredibly precise, totally controlled, and completely personalizable. It allows doctors to create a treatment plan that is tailored to the specific type, size, and location of a person's tumor. So here's your quick roadmap to everything we covered. At its heart, brachytherapy is internal radiation. It can be delivered slowly with LDR or quickly with HDR. The source can be permanent or it can be temporary. But no matter the combination, the goal is always the same: to deliver a precise, powerful dose of radiation right where it's needed most. And all of this really leaves us with a pretty exciting thought, doesn't it? Brachytherapy is already such a remarkable example of personalized medicine. So as our technology for imaging, for planning, and for delivery just keeps getting better and better, it really makes you wonder, just how targeted and how effective can the fight against cancer become?